Okay, we've been asked a number of times to come up with a list of questions on how to find a corrective chiropractor in your area. Bam, baby, there it is, the 7 questions. And Brenda, brilliant gal, one of our members, she asked us to do a video to explain what these answers should be. First off, do you take x-rays? If a chiropractor is working without x-rays, if they say they can feel stuff with their hands, it's not only is it not accurate, but they're working blind. We got to see what structures are involved and what their potential for recovery is. Question 2, do you get spinal listings off of the x-rays? That means you're not just taking the x-rays to sell them, okay, that you're actually utilizing the x-rays in order to guide your adjustments. Question 3, is your goal to restore the normal function or is only symptom relief? Now, symptoms are the end stage of a disease process. It's in 90% of the nerves that come off of the spine, there's no pain fibers. So if you're waiting for a symptom, that's foolish. So you got to look beyond the symptom to the source of the symptom. So question 3 is vital. Question 4, do you take post-x-rays to document structural changes? That is the line in the sand. No, that's the line in the concrete, baby. This is what separates a corrective chiropractor, someone who's putting their skill and their reputation on the line to say that they're going to change the shape of your spine. They're going to initiate force loading in that spine and exercises that they've got the skill level and the experience to actually reverse degeneration and restore or do structural changes of that spine. Question 5, are you familiar with repairing disc injuries? I've heard from a lot of different chiropractors and physical therapists that they're afraid of disc injuries or you're supposed to refer out. You can't refer these out. I got to tell you, doing this for almost 18 years, we're talking hundreds of thousands of people. I've referred 2 people. Okay, so it is necessary, but incredibly rare. So you have to have somebody that is used to assessing what an abnormal dysfunction is and how to correct it where you do a post-x-ray. So if you're skilled in working with disc injuries, that's a skill level that is quality. That's a master. 6, do you work with post-spinal surgery patient? Again, working with someone that's already had steel rods or plates or alterations of the spine, that requires a level of skill and accuracy. And again, you figure there's over an 80% failure rate with post-surgery, with spinal surgery. So, there's a need out there. If a chiropractor is watching this, please up your skill level. Call me. I'll show you how to work with them. And then final, do you work with pediatrics and elderly? Again, that is also vital. You want to work, we get kids in there as young as 2 and 3 days old, okay, right after they're out of the birth canal, because we need to check their spine and nervous system. And then elderly too, they have special needs, particularly if they're in this medical system where they have osteoporosis or multiple drugs or multiple toxicities. You have to know the different skill levels that are involved to adjust those people in those extreme different age groups effectively, gently, but you also have to restore the nervous system. So again, your technique has to be up there. Now, if you get yes to all 7, by God, that's a rock star. Give me their phone number so I can refer them patients. If you get somebody that says yes to at least 5 of these questions, you've got an excellent corrective chiropractor. You've got a 1 in 10 chance of finding a corrective chiropractor, so hang in there. It's worth it. And it doesn't mean that corrective chiropractors are right and people that just work on symptoms are wrong. It's just our protocols are different. It's like the difference between a dentist and an orthodontist. A corrective chiropractor, somebody that's going to answer these 7 questions, has got a skill level, an accuracy level, and a confidence level that I would trust with people that call in to ask my advice. God bless.